So our next session up is Debra Imus and Dr. Angel Falzone. And they're going to talk about caregiver mental health support and medical marijuana. Do we have them ready yet, Kurt? They're here. There they are.
We're here. We're together.
Okay, ladies, how are you today?
Good. How are you?
We're okay. My whole power went off at one point. One of the other presenters' power went off at one point, but we got back every time, so we're good.
Good.
All right, ladies. Are you okay there? You feel like it looks like you're in and out.
Oh, yeah, we're okay. It's just our virtual background.
Okay.
We have a PowerPoint slideshow, so will we be able to share our screen?
Yeah, let me just tell the guy to do that.
Okay.
You got it? Okay, you got it.
Perfect.
Are we starting early, Linda, or are we still starting
Praise God, right?
Okay,
You're here already, so let's just do it.
sounds good.
Thank God. Yeah, oops, let's go back. So we are talking about caregiver mental health support and medical marijuana. So we kind of put these together. I'm Dr. Angel Falzone, and I have with me
Debbie Imus. I'm the owner of Liberate Physician Centers here in Tampa Bay, Florida.
So I really kind of just talking about caregiving in the United States. I was able to get some really great information that's very less than a year old. So I was really excited about that in research. It's hard to find such updated numbers, but caregiving in the United States, there are a lot of Americans providing unpaid care and caring for sick family members. And this is adult caregiving. In 2015, we had 43.5 million caregivers. And in 2020, we have 53 million. So we can see this trend is going up. It's estimated nearly 1 in 5 Americans are providing unpaid care to an adult with a health or functional need problem in the United States. So there's a lot of caregiving happening, and there's not always a lot of resources for our caregivers. So our caregivers are kind of made up, about 39% are men, about 61% are women. It's going to depend on what we're looking at and how that's defined, but those are the about estimates. 26% are caring for someone with Alzheimer's disease or dementia, which can be very stressing and taxing on our caregivers. And then just kind of looking at like who the caregivers are by generation. Our Gen Zs are taking the smallest piece of the pie. They're the youngest. They're providing about 6% of that. Our Gen X are up there. They're providing, is it 23%? Wait, our Gen X's are, sorry, I'm colorblind. Gen X is providing 35% of the caregiving. Our millennials are doing about 23%, and our boomers are providing, a good amount of that caregiving as well. So this is just kind of what's happening across the generations. So what are some of our stressors? So one of the biggest ones are the difficulty coordinating care for loved ones. About 26% of people reported in a questionnaire that this was one of their biggest difficulties, is coordinating all the care between the doctors and the therapies and getting home help and all kinds of stuff. So that is taxing our caregivers. The negative financial impact, about 45% of people talked about how this is, caregiving has negatively financially impacted them at some significant level, which adds stress. 61% of caregivers reported they have to work in addition to providing care for their loved ones as well. And so there's a lot of extra pressures happening. 21% of caregivers reported their own health was fair to poor. So now we're seeing that long-term effects on the individuals giving care. It's affecting them physically, on top of emotionally and mentally as well. And 23% of caregivers reported their health was worsening from caregiving. Kind of burning that candle at all ends can get very overwhelming. Feeling alone, feeling isolated in caregiving, it leaves us out of being able to do traditional things with our generational cohorts when we're caring for our loved ones who need extra care. And it can be very lonely and isolating. It has a huge emotional strain. Oftentimes caregivers, they'll rate their success of caregiving based on the success of the person they're providing care for. And if that person is declining, they kind of feel the blame. And most often people we're caring for can have long-term or terminal illnesses, and they're not going to fully recover, and they're taking that lack of progress very personally, and like they're dropping the ball. And so it's a huge emotional strain from a lot of our caregivers. And then just that feeling like they're just always on duty. Caregiving is 24/7, especially when you're living with a person that you're providing care for. And so there's just that pressure of always having to have what that person needs, to be ready to give what they need, and being on call all the time, 24/7, on top of trying to pay their bills and maintain their life and take care of the other aspects that are going on with life. So there are a lot of stressors that caregivers go through. And I think as a community, we are not talking about them, and we're not looking at them and addressing them to provide the right kinds of support. So with our caregivers, we're seeing, and so these numbers kind of have a huge range, but we're seeing 30 to 60% of our caregivers are showing symptoms of depression, with about a quarter to half of them actually meeting criteria for a major depressive disorder, and 40 to 60% are meeting the criteria for an anxiety disorder. So I kind of wanted to take that and look at what those characteristics are going to be. So looking at some of the symptoms of depression in caregivers, one of the big ones is avoiding pleasurable or meaningful activities. Things we once enjoyed, we're no longer doing those things, or they're no longer bringing us enjoyment. A lot of times with the caregivers I work with, they'll feel guilt from taking time off or doing something fun, like they're not allowed to have enjoyment because they're taking care of a sick loved one who can no longer enjoy that thing anymore, and they feel guilty for doing it for themselves. So they're not. Having repetitive nightmares or intrusive thoughts about the loved one. And this can happen with feeling those intrusive thoughts that something bad is going to happen, fearful things kind of they're thinking about within the caretaking of that person. And that's something that can be very consuming for a caregiver when that starts to happen. It's almost like those intrusive thoughts are coming in and feeding them like something bad, impending doom is going to happen. And so sometimes you can feel like they're losing it a little bit, like that can be very stressing on them. So they work harder because they don't want that bad thing to happen. We see a lot of inability to sleep. This happens from A, just not having enough time in the day to get everything done. B, this happens because they're constantly thinking of all the things they need to get done. And so their brains are going, and trying to figure it out. It can happen because they're worried about the things that are going on in their life. And so it's kind of like the little hamster going around on the wheel in their brain all night long. They're exhausted physically, but their brain's got that little hamster just running around that wheel of all kinds of thoughts going through their heads of what's happening in their world and how they can manage it all. And so we see sleep deprivation is huge with our caregivers. And sleep is super important for our caregivers because sleep is the time that our brain literally washes away the neurotoxins that we get from stress and anxiety and depression. And so it starts to wash those neurotoxins off our brain. And so when we don't get sleep, we start the next day in a deficit. And so then we have less of that brain power to handle the next day's stressors, and it keeps kind of going down that slippery slope. So sleep is so important and so crucial, and it's one of the things most people struggle with. Feeling of exhaustion. It's physically exhausting to take care of somebody, especially someone we love and somebody who has lots of needs. Working with the ADLs, working with, making sure they're at appointments and medications and getting their therapies and, trying to provide all that can just physically be exhausting. And especially when we have a lot of our caregivers also maybe caring for their children or their grandchildren or other people in their life as well. So there can be a lot of stuff that leads to that exhaustion. Feelings of tension So when we just start to feel like tense, when we're holding our muscles more stiff and rigid. So you might have headaches, backaches, neck aches, leg aches, like we can tense. And when we start to tense, that over a long period of time, we'll start to physically feel that, and depression can manifest very physically in our body. Inability to concentrate and remember details. I think this is another one of those most common things we hear here in our practice, because when we are feeling overwhelmed and we're feeling stressed and we start to feel depressed, the way our brain is working, it's releasing too many excitatory hormones. And when that happens, we're not able to concentrate and focus and remember small everyday details. Our brain's not grabbing that information the way it needs to. And so we're frustrated. We can't find our keys. We can't remember where we left the prescription to take to the doctor. We don't remember, what we're supposed to do today or who was coming to do that. And so we get very frustrated with that. So that's another big sign of both anxiety and depression. Anxiety attacks regarding caregiving. And so when I'm talking about that, I'm talking about feeling that pressure on your chest. A lot of times people feel like an elephant is sitting on their chest. They feel that pressure. They might get hot sweats or cold sweats. They might get very red and flushed in the face, extremely thirsty, maybe difficulty breathing. Their heart might be racing. And those are the physiological signs of some anxiety. Inability to talk to others about their experience as a caregiver. When we're not sharing our experience, we're really on risk of more isolation and depression, because it's hard and it's physically and emotionally and mentally taxing and financially taxing in a lot of areas of our lives. And so we need that support. And when we pull away from support, or we don't have those people that we can talk to, it definitely leaves us more vulnerable for depression. Inability to enjoy our activities, feeling chronically irritable, kind of that always in a bad mood, but we're kind of a little extra jumpy. We're not quite ourselves when we're really not feeling ourselves. We're crabby at people that we don't mean to crab at, and then we feel guilty for crabbing at them. That can be a sign of depression. And then just feelings of general overwhelm, worthlessness, inadequacy, feeling like we're a failure. Like those are huge signs that we're kind of tunneling into some of the depression. And then some of our signs and symptoms of anxiety are constant fearfulness, worry, feeling like that impending doom. That anxiety can just be very overwhelming. Can be that overwhelming feeling that something bad is about to happen, or I'm really fearful of this thing, or I'm constantly worrying about something, so I'm thinking about it all the time. If we have depression that lasts longer than 2 weeks, that leaves us in risk of anxiety as well. And a mental health component, anxiety and depression are kind of a married couple, so they go together. So we often see those together. Having trouble eating.
What, I'm sorry.
Lewy body dementia versus.
I'm sorry, I got this thing in my ear.
Okay, can you stop it?
Yeah, I think it stopped automatically. I think they're having some technical difficulties. Okay, somebody.
Discussing Parkinson's and Lewy body dementia.
Yeah.
So there's some questions here.
Okay, sorry, trouble eating can be a sign of anxiety in our caregivers. Not eating too much, eating only comfort foods, constipation, diarrhea, all those things can kind of come in as signs of anxiety in our physiological. Shortness of breath that keep coming back. Again, sleep problems we see over and over, because sleep is so imperative to the renewal of both our brain and our body and getting us our energy. And so when we have deprived of this sleep, we are very more vulnerable to a lot of other mental health stuff. We see racing heart, constant irritability, excessive sweating. Those are all anxiety symptoms. You'll see there were some repeats from depression, because like I said, they are a married couple. And so a lot of times there's some overlap between them and how they manifest in our bodies. So I wanted to kind of really look at caregiver burnout, because that's, I think, a huge issue. And I think a lot of caregivers are burnt out. I think they're on the verge of it and they feel guilty about it, and they don't want to talk about it because it makes them feel like they're not a good caregiver. And so some of the components that lead us to that burnout or feeling burnout is stress. And we know with caring, there's a lot of stress, there's constant stress, and that leaves us emotionally exhausted. And then in the taking care of other people and ourselves can leave us to physically being exhausted. And so we have that fatigue. So stress plus fatigue typically equals kind of where we are in burnout when we're looking at someone's burnout risk. And so that burnout's that mental exhaustion. And then we see that risk for anxiety and depression just multiplies. So when we're trying to look at where someone is in their burnout ratio, we want to kind of see what stresses are they having, where's their physical exhaustion level, and what coping skills and supports, because that can help protect against burnout. And so can help us to not fall into that depression and anxiety. So some signs that we might have some burnout: easily frustrated, quick to anger, forgetful or foggy. Again, those go back to some of those depression and anxiety symptoms. Getting sick more often. So our immune system, a lot of it is held in our gut. And when we are having too much stress for too long, it lowers our immune response. And so we will catch more colds, or we'll keep them longer than the people in our household. So we will physically get sick more often than our typical or other people around us. When we're feeling anxious or depressed, and this might not even be clinically at the level of anxiety or depression, it just may be an over feeling of anxiety or depression. Hopelessness or helpless, when we don't feel like what we're doing is making a difference or helping, or if what we're doing is hopeless, then we're really in a vulnerability to burnout, because that is one of the driving things that helps us as caregivers to continue through caring, is knowing what we're doing is making a difference. Being extremely tired, if you're feeling like, oh my gosh, you wake up and you just can't wait to how many minutes or hours it is till you get to go to bed, or you're counting the days till you have a day you can sleep a little bit, like that's physically tired, and that we're really on the verge of burning out or in burnout. And if you're unable to relax or care for your own needs, and this is a huge one, because caregivers typically care for themselves last. They give all their energy to the people around them because it takes a lot. And then their own needs aren't getting met. So we're not doing the things that we need to do for ourselves to make sure we're okay and we're healthy and we're taken care of. And so we can't sit down and enjoy that funny movie, or we can't stop and take that nice relaxing bath or that sunset on the beach and take a 20-minute break, because we don't feel like we are able to do that. We have to pour out and pour out and pour out. And so we pour, but we're not taking back in. And so that's a huge sign of burnout. So trying to prevent our burnout, asking for help is one of the most important things we can do. You know, typically people around us, when we're in those kinds of situations, they want to help and they don't know how to help. They don't know what we need as caregivers. They can see the overwhelm on us. They can see the stress. They can see the emotions. And people who love us want to be able to help us, but we need to be able to ask for that help and give them specific things that they can do. A lot of times people are willing to, if it's go pick up a grocery order or grab drive-through, or a member of the house can make dinner a night a week, or to take care of a load of laundry or bring out the garbage. Like giving specific tasks to people in our world is really important to help us prevent our burnout, but stay strong and stay healthy for ourselves. We cannot do everything. It is physically impossible for us to do everything alone. So having people around us that can provide even small tasks can be big help and can help us not burn out. Giving yourself permission to take a break. You are human. You need a break. It is part of being human. There is no Wonder Woman or Superman that do not need to fill their cup, that do not need to take those breaks. And giving yourself breaks is an act of love to you and the person you're caring for. When we give that break, we are feeding ourselves and re-energizing ourselves so that we have more in us to to give in the world around us. And so giving yourself a break is part of keeping your body healthy and strong. And it doesn't have to be a long break. Short breaks can be very, very helpful. Like going and sitting outside and having a cup of tea in the morning, or seeing sunset on the porch, or going for a walk around the block, or sitting and watching a TV show that brings you joy, or doing a craft that you enjoy for a little bit. It doesn't have to be a lot in those breaks. Little bits make a big difference. In fact, I would rather see people take smaller breaks and have a few of them in the day than like save up and have these longer breaks, because the smaller breaks help us to renew in those moments. And so it gives us that habit of taking breaks. And a lot of us see a break as negative. I'm being selfish if I go do something I enjoy, or I'm being selfish if I take time for myself. And it's not. It's being a caring person to you. And you have to take good care of yourself. And that means all of ourselves. That means not only making sure we're getting our rest, but are taking our vitamins. Are we getting the nutrition we need? Are we getting the exercise we need? Are we, making sure that we're taking care of us? Are we going to our own medical appointments? I find a lot of caregivers spend so much time going into appointments for those they're providing care for that they don't go to the doctor and make sure they're okay and make sure they don't have things that they need for themselves. And so that's really important that you put you on your schedule, because you need to care for yourself too. And that's where we see a lot of our caregivers reporting their own negative physical health. And I think it's because they neglect. A lot of times it's easy to neglect caring for yourself. Plugging into support groups, really important. Having support, it goes a long way. It's a huge preventative, protective factor for our mental and emotional health and our physical health. We have to have people that can support us, and it can be a support group that is organized and meant for caregivers, or it could be just a support group of other people who have been in the same situation or are in the same situation. A lot of times you guys can provide ideas for each other, give each other room to talk about your experience, whereas maybe your friends aren't caring for other people and they can't relate to that experience. So they aren't able to help you process what those emotions are like or what that stress is like. And so plugging into support groups is the #1 protective factor for our mental health. Having people who can hear us, who can provide us ideas, who we can listen to, really makes a huge difference in us feeding us and being able to pour back out. We talked about delegating tasks, but there's a huge importance. Like, this is how we prevent burnout. We have to delegate. We need to get specific, and we need to use people's strengths. What I have found, a lot of times people want to help. They just need to know how to help you. And so asking for help is not a sign of weakness. Asking for help is a sign of recognizing I cannot do everything. I can't be everything to everyone in my world, and I need help. And there's a sign of strength in asking for help. Invest in activities that give you meaning. This is a great time for a hobby or a craft or watching a sporting game or things that feed back into you. Everybody has different things that kind of re-energize them, but we can't push those aside because they're not important tasks. They're very important to our mental and emotional health and our physical health, because those are the things that help to relax our brain. Those are the things that send the protective hormones in our brain. Those are the things that help get rid of all those excitatories from stress that wash over our bodies. And so this is what helps to bring our bodies back down. And so whatever those activities are, plug into it. If it's watching comedy, if it's listening to YouTube and comedy, if it, sitting outside and just being a part of nature, finding whatever feeds you. If you don't have any ideas, I literally have lists of hundreds of things people can do that feed them, because this is one of the most important things we can do for ourselves, is making sure we're feeding ourselves. Maintaining our personal relationships. This is a big one. I find in a lot of caregivers we work with is that they kind of disconnect from their friends and family some, because their time spent in caregiving and working and trying to stay afloat. And our personal relationships are important. They're part of our support. It's important to have a friend that we can go have that cup of coffee with, or they can come over and we can, you know, chit chat a little or whatever. The personal relationships is what helps us find meaning and purpose in our own life. It helps us to feel supported. It helps us to feel like what we're doing makes a difference. And it's a huge protector to our mental health as well. And so we want to try and not disconnect because we're overwhelmed and busy. We may have to limit some of that interaction, or maybe have to double it up and have our personal relationships maybe come over to your house and have that cup of coffee so that you can, you know, make sure you're there for the person you're caring for. But we need to connect. That's really, really vital part of getting through and doing this well for ourselves, and talking about our feelings. So often we stuff the feelings. We feel guilty. We feel ashamed if we have a negative feeling. If we start to feel overwhelmed, we start personalizing those feelings and feeling like, I'm a bad caregiver, I'm a bad person, I'm a bad daughter, I'm a bad wife, whatever role we are, we feel negative about that. And we're human. And at times it's hard. And it's okay to say, this is hard. It's okay to say, I'm not sure if I have it in me today. Like, we need to talk about it. And when we stuff it down, like, we're way more vulnerable to depression and anxiety. And we're also vulnerable to not giving good quality care because we start to get really overwhelmed. And so talking about it gets it out. Talking about it helps us to process it. Every one of us are human beings. And I know I say that, but we expect ourselves to be this superhuman when it comes to caregiving, and we're not. And we're going to have days where we have great feelings about what we're doing, and we're going to have days where we're not. And it's okay to say those, and finding people that you trust to hear you and that are there for you and to be real about those feelings is really important. To be able to acknowledge, this is what I'm going through. And yeah, today it stinks. Today I'm exhausted. Today I'm not sure how I'm going to pay the power bill and I'm feeling overwhelmed, or, you know, whatever it is, or I'm feeling like a taxi. I've been to all these appointments and I'm just tired of being on the road. It's okay to say those things, because then we can get it out and put it in the shelf where it belongs, and not keep it in us where it becomes toxic and a venom to us. And when we keep it stuffed down, we start to feel negative feelings towards the person we're caring for. And we don't want that to happen and come out in our caregiving. So that's a huge strategy for preventing burnout. So caring for the caregiver, you know, we can't pour from an empty cup. I say that all the time in therapy, because so often we try to, and we're just, it's like a bank, it's like an emotional bank account. We are in the red. We are taking from an account we're not putting into the account. And so we have to pour in to take out. When we take out more than we have, that's when we have physical issues. That's where we see the strain on our mental health, our emotional health, our relational health, and we start to get tunneled in and we start to feel very miserable. And so making sure you are caring for yourself, or you might have somebody that can help remind you to care for yourself, and making sure you are attending all your medical appointments, and making sure you're getting your lab work, and making sure that you're taking your vitamins, and making sure that you're exercising, if it's just going for a walk around the block or getting on an elliptical or whatever you do. Relaxation techniques, I can't speak to these enough. These are super helpful. They're super easy to do. It's something you can do by yourself. It's something you can do with people. These help to wash out some of those stress hormones from our brain as well. So it'll give you back better focus and better concentration and better memory. So things like yoga and meditation. One of my favorite meditation, you can find them like on YouTube. They're the whole body, where you're just kind of connecting. You'll find where you're carrying that stress that you didn't realize you were carrying that stress. Those are really great relaxation techniques. Going on a mindful walk and just staying in the moment and paying attention to what's happening. You'll start to realize outside noises are louder than you realize, because we filter all that out all the time. Eating well, making sure we're eating healthy. A lot of times we're in a hurry. we are going through drive-through and we're getting lots of empty calories, and that's not helping to fuel our body. And so whatever we can do to help ourselves eat well is important. These days are lots of great meal delivery services that can help bring us healthy food. There's a lot of things that we can do to kind of prepare ourselves for that, instead of going in, oh my gosh, I haven't eaten all day, let me hit this drive and get this. We want to kind of get out of the drive-through and into having our good nutrition and vitamins for our body, because that's going to give you better energy for yourself and feed your brain and feed your hormones and feed what you have to give. And so these are putting back into that emotional, mental, physical bank account, and the quality of sleep. I cannot express how important sleep is. We want sleep to be at least 8 hours. I know a lot of people talk about, oh, I get 4 or 5 hours, but sleep is not something we can get caught up completely on when we lose it. In fact, we will have time change this week, and it literally takes our bodies 2 weeks to completely recover from 1 hour of sleep. So think about all the hours of sleep we get behind. Like, our bodies are working in deficits. And so it's really important that we try to get that sleep quality. If it's a really great thing to help with your sleep is relaxation techniques before you go to bed. Reading or meditation or prayer, or those things that kind of help wind your brain down. Writing to-do lists of everything that's going through your brain. Keep a notebook next to your bed and kind of brain dump is what we call it. That way you're not holding on to it all night long, and your brain doesn't have to keep thinking about it. The things that are bothering you or worrying about, you can make a list or talk it into your phone and have a voice list. The more we can get out of our brain and somewhere else, the less our brain has to hold it on, and then will help us to improve our quality of sleep. So I'm going to turn this over to Debbie, and she's going to tell you a little bit about medical marijuana.
All right. Hey, everybody. So again, I'm Debbie Imus. I'm the owner of Liberate Physician Centers. We are a medical marijuana clinic here in the Tampa Bay area. And what I'd like to do is spend a little bit of time talking about how cannabis and mental health kind of go hand in hand. Cannabis interacts with the chemical receptors. And when these receptors are activated, it helps send signals to the brain, the nervous system, and the immune system to help us achieve healthier functioning. And as Dr. Angel talked about, that includes sleep, memory processing, and positive moods. So cannabis and mental health, again, cannabis has been and continues to be researched here in the United States in areas of physical and mental health in specific conditions. Unfortunately, in the United States, we're really behind the 8 ball. And in our industry here in the US, most of our research actually is coming from Israel. They've been doing extensive research for over 30 years on cannabis and specifically mental health. Cannabis has been used for over a decade to treat some mental health conditions with individuals experiencing improved quality of life and a significant decrease in symptoms. So how can medical marijuana help? A lot of those conditions that Dr. Angel just talked about, we're talking about relief of chronic pain. It can help with weight loss. It can help regulate and prevent diabetes. It can help fight cancer, helps treat depression, regulate seizures. It helps with ADD and ADHD. It can help treat glaucoma, alleviate anxiety. It can help with PTSD symptoms. Insomnia is a big one. It reduces tremors and Parkinson's disease, and it helps with addictive treatment. So here in the state of Florida, I know this is a national conference, but in the state of Florida, we recognize what we call primary or automatic qualifiers. That's cancer, glaucoma, chronic pain, HIV and AIDS, ALS, Crohn's disease, PTSD, and other mental health conditions, epilepsy, Parkinson's, and MS. So with these main conditions in our clinic, probably the 2 major conditions that we see are your mental health, and it's going to link back to this medical conditions of the same kind, and chronic pain. And again, the chronic pain is going back to other conditions. In the state of Florida, there's probably close to 200, 250 conditions that we can actually see patients for. So there's always myths. So with medical marijuana, as well as mental health, mental illness, there's a lot of stigma around both of those. So we've got a couple here. Medical marijuana does not have any medical uses. And again, that's definitely a false statement. Many doctors are supporting the use of medical marijuana. More and more doctors are kind of coming on board and looking at medical marijuana as opposed to opioids and other prescriptions. There are actually more than 2.5 million medical marijuana patients in the US, and there are more and more studies are demonstrating the medical legitimacy of marijuana. So another myth, medical marijuana is an excuse to get high. Again, false. A lot of people might think of smoking and getting high as the only benefit of medical marijuana, but there are many other applications, or as we call them, routes that you can use to treat conditions that do not offer that euphoric or high feeling. And those usually are products that are more higher in CBD and lower in THC levels. And the last one, medical marijuana can only be smoked. Again, no, that's definitely false. So many other so many other routes that you can take to use. So some of those are, and we break them down into three major categories. It's going to be topicals. Those are going to be creams and lotions, and those stay on the surface of your skin. They don't travel. You put them right where you need the application to be. We also have transdermals. Those are going to be your patches, and you put those on and they travel away from the application site. So they're actually going to go through the bloodstream and go to the area that we're trying to treat. And then the biggest would be our consumables. Those are going to be edibles, sprays, tinctures, topicals, vape. And then the newest here in Florida, of course, would be the edibles. So we loved this map. Since this is a national conference, we're located here in Florida, but we wanted to show you how the US views medical marijuana by state. So your green states are recreational. I will say that in the recreational states, there's always a medical side to that as well. Typically, your cost is going to be a little bit lower with the medical side of it, and the quantities are going to be higher because we're actually treating conditions as opposed to recreational use. Your blue states are medical, so legal for medical use, and your red states are illegal. So they have not gotten on board for either recreational or medical use marijuana. So here in Florida, the process of obtaining your medical marijuana card, and again, based on that map of the United States, you can check with your individual state. But in Florida, you have to be either a permanent or what we call a seasonal resident. Seasonal residents have to be in the state of Florida for 31 days or longer. You have to be diagnosed with one of those qualifying conditions by a physician, and that can be a specialist or an MD. You see the doctor, you're registered or you're entered into the Florida Medical Marijuana Registry. Once that occurs, then you actually obtain a card in the state of Florida. Now, Florida does not offer reciprocity, so you can't take your card from, let's say, Colorado and come here on vacation and use it. Has to fall into one of those, either a permanent resident or seasonal resident. So with Liberate Physician Centers, we have two locations. We've got one in Tampa and one in Largo. We offer personalized care for each of our patients. We've got 3 different types of services that we offer. We have a doctor that's trained specifically. He's retired OBGYN. He's been with us for 1.5 years. So he is licensed in Florida, medical marijuana card holder himself. we offer our biggest, we are big advocates of education. So we want to make sure that our patients understand, based on the condition that we're trying to treat, what cannabis routes and quantities are going to help them. And then that comprehensive treatment, we assist with the application. We have an option where we'll go to the dispensary with our patient the first time. So again, depending on what our patients are looking for, we usually have something that we can offer them. So again, 2 locations. We're located in Tampa and in Largo. We offer private consultations by a licensed physician. We offer assistance with completing that state application, that comprehensive professional guidance on the marijuana products based on the conditions that we're treating. It's pretty quick and personalized in the treatment, and we offer a pretty robust referral program for our patients that are in-house with us. This is our contact information. So www.Liberate Florida is gonna, there are other Liberates located around the state of Florida. Again, we're Tampa Bay with the 2 locations located in Largo and also in Tampa.
This is Dr. Angel, and I'm back to let you know. So we have a practice here in Clearwater, Florida. We serve patients all across the state of Florida. We have through telehealth video services if they're not in our location. We work with a lot of caregivers and provide a lot of specific caregiver support. We also do assessment and diagnosis for mental health. We support medical marijuana for patients who have a qualifying disorder and can benefit from that. We do individual and family therapy. A lot of times when we're having caregiver needs, that family kind of needs to kind of wrap around it, and whatever kind of dynamics were already going on in a family sometimes really come to the surface when we are having to do caregiving or a member is chronically ill, and that can make more conflict and cause more stress. And so our goal is always to help minimize that stress and to provide as much healthy functioning and support as we can. We do psychological testing. So a lot of times we'll see even our caregivers come in who might be caring for someone and they're like, oh my gosh, I am thinking I'm having a memory problem disorder because I can't remember this or I'm forgetting that. And so I'll do that assessment to either verify or to show them they don't, or to see, oh, you're starting to, like, maybe we need to get you some help now too. A lot of times though, it's just that stress reaction and they're not, and it helps them to feel better when they can see that for themselves. But we do that psychological testing. We also do virtual reality therapy, which we are the only provider in the Tampa Bay area that uses actually a virtual reality Oculus type device. And we can take people into about 150 different environments to help them either work on their stress, to work on maybe specific phobias, to help them relax, to help them, to give them some skills to calm their brain. Addictive disorders will have claustrophobia. I have patients who come in who have to have an MRI, and there's a lot of anxiety for people around MRIs, and we can do that virtually and teach them how to deactivate that stress response in the brain so that when they go have the real MRI, it's not as overwhelming for them. And so we have lots of different medical things that we can walk people through. And so this has been huge help for a lot of our patients to get through things that we just can't normally control in therapy. And utilizing a virtual reality type setting, we can help bring them where and help them get through that and get tools and skills so they can face whatever it is that's coming to them. I've had another one having to go on a flight and had a lot of fear regarding getting on an airplane, and we worked through that through the virtual reality, and she was able to take that flight without any panic, without adding extra medications to her. And so that was a huge success, and we've had so many success stories working with this modality specifically. It works best when people can be in the office, but we can actually do this at distance as well. And so that is another plus for this type of therapy. And then our office is in Clearwater. So does anybody have any questions or comments?
Somebody just asked a question. So what is tincture?
Sure.
Tinctures are a liquid drop. So it has, like a little squeezy type top, and it's a topical, or not a topical, it's a liquid, and you put it under your tongue.
Okay. And somebody else asked, what's the wax stuff? Is there wax stuff or something?
Yeah, so wax is another route that you can take. Sometimes the wax can be put in food.
Okay.
You can actually, make it a liquid as well, but it's a more concentrated, usually more specifically THC heavy product.
So how have you seen people with dementia get help?
So people with dementia, it actually helps. And again, this is typically a more CBD concentrated product,
Okay.
but it helps kind of quiet the mind. It helps focus, similar to ADD and ADHD. So it's really just, bringing focus in. And I actually have a bottle to show. So,
Okay.
oh.
See if I
Well,
can get that
there it
there.
is. There's a tincture bottle.
Okay. So it's like nose drops, like old fashioned nose drops or something.
Yes, yes.
Yeah. So somebody comes in and they bring their loved one that has dementia, and they come and they meet with the doctor.
Yes,
And then they go through that approval process.
correct.
And then the doctor recommends whether they should take topical or what, like explain how that process is. Because people are going to say, I'm just going to go in, they're going to give me some stuff, I'm going to take it home, I'm going to be good. I think there's a whole process, right?
Yeah, there is. And a lot of it, because a lot of people actually have experience with cannabis, either in their youth or, they got a guy. So, let's say they are diagnosed with dementia or on, this onset of dementia. So it really just depends on the patient's experience with cannabis, and that kind of drives what's recommended by the doctor.
Okay, I'm trying to see the messages. Can you see the messages there?
Yeah, we saw some chat.
See here.
Yeah, but like, this is not like going to a doctor and they want to give you an antibiotic and they say, okay, here's your 21 pills, take 3 a day for 7 days. Like, this will be different products work differently for different things. They metabolize differently in individual people's bodies. So there is a strong need for an education component. And so if you're in Florida,
Well,
like, that's
some
why
kind of
this is
adjustment
working with
period.
Debbie. Huh?
Probably some kind of adjustment period too, about how much you
Yes,
take, or what
yes,
time for you to
yes.
take it. So someone just asked a question and says, we just joined hospice in Pinellas County. Will your products be approved?
So approved for hospice. So it's not covered under insurance.
Because it's still federally illegal.
I think they're kind of asking, will hospice let them bring it in? That's
That
what
I'm
the question to me.
Which hospice? Because I know there's several different hospices here.
It just says we just joined hospice in Pinellas County, so it either has, I would think it's either Seasons or Empath. If
Okay.
the person that put that question in can answer me, we'll
Yeah,
go a little
and
further.
Empath, okay.
and they might have to come in and administer that for their loved one. It might not be where, you leave the medical marijuana and the nurse, administers that. So we've seen that where they allow the caregiver to come in and administer to the patient.
Yeah, that's what I heard, especially like, a lot of people just go in, just bring it in for their loved one.
Mhm.
And they're the one that does it, so the staff
Yes.
doesn't have to get involved or anything
Correct.
else.
Correct.
All right, but there's no like rules against that or anything.
Well, I would check with them individually.
Yeah, I think they each have individual policies.
Right.
Okay. Now, before somebody comes to see your doctor, should they go to their regular doctor and get a whole workup first so they know where they're at?
Yeah. So when a patient chooses to use medical marijuana, we recommend that they talk to their doctor about it. Their doctor is not going to be the one that, basically gives them, what's the word I'm looking for?
Prescription.
Yeah. Or
Referral.
Referral, yes, thank you, Linda. So and some doctors do. Often we get patients that say, hey, I talked to my doctor and my doctor said, yeah, you really need to, consider getting your medical marijuana card. So it could be either direction. It could be that they've already had that conversation with the doctor and the doctor's recommended that they do this, or the patient themselves is considering.
Yeah,
I
they
think
definitely
sometimes the
want to.
patient's afraid to talk to the doctor about it, though. I think sometimes the patient's afraid to talk to the doctor about it because they think it's no.
Yeah.
Yeah, because of the stigma with it.
Yeah.
And actually what we've seen in a lot of patients is, especially like chronic pain patients who might come in on a lot of narcotic and opioid type drugs and have lots of side effects. Even some of the mental health drugs have some really difficult side effects.
Oh, yeah.
That they're able to, with medical marijuana, wean off of a lot of that, if not all of that, and get their life back. And so that we have watched disorders like bipolar disorder being managed very well for some of our patients without having all those side effects of the traditional drug therapy route. It is, and that's part of the problem, is the stigma still there. And that's why we want to get out and educate people, because there is great medical uses and it works well for people that can metabolize it well. And it can be a great alternative to all the traditional pharmaceutical routes for people with less side effects. So
So somebody just said, so what kind of costs are we looking at?
Well,
it's going
to vary by state. If for folks that are outside the state of Florida that want to consider, starting a regime of medical marijuana, they would have to check locally to see what those costs are. But for us in our clinic, we have 3 different price points. We go as low as $175. We go as high as $295. So our $295 includes us going to the dispensary as a patient advocate for the first time. And usually this is someone that's kind of unsure, has never dabbled in any type of marijuana and just needs that extra help. So whether it's a price point or service, we have something for everybody. Now in the state of Florida, your certification with your doctor is good for 7 months. So that is the state max. No doctor in the state of Florida can go longer than that. So every 7 months you need to be recertified with your physician. Your card itself goes, is with the state of Florida. That's good for 12 months. So we've got 2 different dates.
How much is the card?
The card is $75 and there's a $2.75 processing fee. So once a year you pay that. Every 7 months you see our doctor.
Okay.
And I talked about the referral program. So for folks that are local, our recertification is $145, but our referral program is once you're in-house with us, anybody that you refer to us, you get $25 credit towards that recertification, and we don't cap it. So we set it up so that our patients could have either free or significantly reduced recertification. And that resets every 7 months. And we don't distinguish between an existing patient that's just transferring to us, wants to take advantage of that referral program, or a brand new patient. They're still getting that $25 credit.
All right, so give me a fabulous success story.
So I would say our biggest success story was a fellow that came in his 30s with severe Tourette's. He had the verbal tics, he had the body tics, and he walked in our door one day and said, hey, what do I need to do to get my card? I've tried everything else. So he saw our doctor, and 7 months later, when he came in to see us for that first recertification, totally different man. He didn't have the verbal tics, didn't have the body tics. And, he almost cried in our office and said, I can't believe that, I've got my life back. Like I've never been able to function this way. So that was very gratifying for us. And there are lots of them, whether it's a cancer patient, epilepsy.
I remember years ago, I was in a support group. I was facilitating a support group, and this woman was like, if I could just get some marijuana for my husband, it just makes him feel so much better. He was so sick.
Yeah.
And she ended up getting it from the guy on the street or something.
Yeah.
But I remember feeling so sad at that time because she had to get it from the guy on the street. There was no way to, and that was the only thing that was working for her husband.
Right.
You know, and that was just, it just helped his cancer, it helped him be more relaxed, it helped him chill out a little bit. And I just think that's so important. And I think people have so much fears because they don't know enough about it.
Exactly. And you hear stories of, you know, I mean, we're talking about the stuff that's on the street. Unless you know the person that's actually growing it in their yard, they're getting it from
Right.
somebody else.
Exactly.
So there is that fear factor that, you know, it could be.
Mixed with something when you get it off the
Yeah.
street. And then when we're looking at like treating anxiety with medical marijuana, like people who get off the street, some strands of medical marijuana can make their anxiety worse. So that's why it's really important to go the medical route as opposed to getting it from the person off the street, because there are certain mental health disorders it can spike if you get the wrong strand. And there are different strands of medical marijuana used for different things, which is what that education process will help you say, okay, this is a disorder. These are the strands that work for that. These are ways that you can utilize it, your routes that may be more helpful for you. And so.
Well, I can remember about, this was right before COVID, and I was speaking at a Rotary group actually. And at the end, they passed a basket, happy dollar, sad dollar, whatever. And this one man, he's probably like 70, 80 years old. He puts $1 in the basket and he said, we moved down here 30 years ago. One day we went over to my son's house and he had a bong on the table. And my wife got so upset. Oh my goodness, I'll never come in this house again. It's just terrible. Like she was just so terrible. He said, this morning I took her to get her medical marijuana. So, and he said, and she's so much happier. She's sleeping so much better. I remember that's what he had said at the time. But yeah, we just have to get that stigma away and get the education.
Exactly.
It's an opportunity because, you know, we take so many different medications that are so, I feel so harmful for us. You know, they help one thing, but then they make something else a mess.
Exactly.
Oh, no, absolutely. And so when we're looking at like, if somebody's needing a mental health qualifier, so we do those assessments, we do them over the phone. And we provide the documentation to the doctor over at Liberate so that they can get their card. So, because there are doctors who aren't supportive, especially in the mental health realm. And so people might be, you know, taking like long-term antidepressants, long-term anxiety, and may want to try the medical marijuana route. So we can give that diagnosis with a phone interview and that paperwork, and that our whole process is only $50. So to get it to her for the next part of the process. So if you do have a doctor that isn't as on board, but you think it might be in your best interest, we can bridge that gap for you guys.
That's fabulous. That's fabulous. Any last words for our listeners today?
Well, I think, you know, making sure you're taking care of yourself. You know, I can't preach enough. You can't give what you don't have, and making sure that you're taking care of you as a caregiver so that you can give the care that you want to give to the people you love around you.
Yeah. And if you're considering medical marijuana for, you know, treating any of the conditions, just remember everybody's body metabolizes it. You're not going to get a prescription that says take this twice a day with, you know, certain amount. You have to try it and see how it's affecting you. So we always recommend go low and slow. You can always increase, you can always add to it, and keep a journal. You know, just keep a journal yourself to notate, you know, are you taking it in the morning? Is it on a full stomach? You know, how did you sleep at night? And just, you know, jot down your thoughts and how you're using it, because that'll help you on your journey.
I have one more question I think that just came in. I think it would be great if you could address this. It said, I would love my mom to try it. Her GP, as open-minded as he is, thinks it isn't good for depression. She has been on an antidepressant, situational, after my brother died 35 years ago. And I think she should have been taken off it. What would be the best way to go about that? And should we go against his opinion?
Well, my question would be why he doesn't think it's good for depression. Is that he does not think the research is good, or does he think there's other risk for that specific person? I definitely would want to know that. And if it's that he's not sure about the research, you know, there is a lot of really great research. It is out of Israel, and it's very specific to depression, PTSD, and anxiety that shows the efficacy. So if he's not on board, you know, she can always go an alternative route if they want to give that a try.
Yeah. Absolutely.
I think, you know, if you could go off an antidepressant after being on it for 35 years, I think that could be a good thing.
I agree. Any long term, especially the the psychotropics and the mental health, there are a lot of really challenging side effects with those. And so if we can get off of
Some
some
of
of
the
the,
antidepressants too, all it does is mask it.
sure,
Yeah.
and they
It
stop
doesn't
working
make
after a
anything better.
while. And then our anti-anxiety drugs, most of those are highly addicting, and so you need more and more to get your effect. And so there are some high risks with mental health drugs.
Well, thank you for being with us today, ladies. I so appreciate you. As more questions come in or emails, I'll be in contact with you and we'll chat further.
All right, well,
right,
thank
sounds
you for
good.
having us.
Thank you. We enjoyed
Thanks.
it.
So here we are, the wrap up of day number 1. I will say it's been a little challenging. One of our presenters, the power went out in her office. The power went out in my place for a little while, but we seem to have made it through the day. So I hope you enjoyed everything that happened today. Please tune in tomorrow morning at 9 o'clock. Tomorrow we have Dr. Kate McCarty from Survive to Thrive, partnering with dementia. We have Dr. David and Melissa Bernstein, which is health and engagement in the kitchen. That's going to be fabulous, a meaningful and fun activity. We have Dr. DeLon Canterbury, Let Your Body Choose Your Meds, precision medicine. Yoga for Caregivers, A&E equipment again. And then we have Maureen Rulison and Brian LeBlanc. We are living strong with dementia. And then last but not least, we have Pastor Kurt Seedfeld, and he's going to talk about making yours a dementia-friendly faith community. All right, I'll see you tomorrow morning. Thanks so much. Have a delicious day.